what I remember, and I've been using sort of May 1st as sort of the first date that I had an issue. Probably a few days before that, but that's what I can kind of remember. So I'm a real estate investor. I was visiting a small town, was walking down a brick sidewalk, and I just felt like both of my legs got heavy and like they wanted to just kind of give on me. And they didn't, and I powered through it. And so at lunch that day, I noticed this dull ache in my lower back. At that time, no pain. I thought, well, maybe I've got a disc problem. Who knows what's going on. And you maybe saw this on the MRI. I do have a bit of scoliosis that I've always been mindful of. So, maybe I just sat in the car ride wrong or something like that. So, didn't have any issue after that. But a couple days later, I returned back to Richmond, Virginia, where I live, and I was walking a couple blocks to the grocery store from my house, and my legs felt like they were definitely getting heavy again, and like they wanted to give out. They didn't. I just kind of stopped and powered through it. But that first week of May, my legs just felt weird. They felt kind of off. I had that lower back pain kind of increased. And when I say pain, it wasn't sharp or stabbing or like sciatica, like I would typically hear of, because I kept waiting for the
Mm.
lightning, so to speak, pain, and I never really got that. And so I went to my GP. He said do some twists, do some bends for me. Didn't really trigger anything major, but I just felt like this heaviness kind of in my legs continued. And so he said try some physical therapy. I tried that, did some McKinsey stuff. Didn't really help. One night I woke up and both of my legs were kind of tingling. They felt a little off. Again, I never lost what's weird is I never lost like stationary strength. I could pass all the, clinical weakness tests, no foot drop, none of that stuff, and no pain, but I just had this weird gait and this like unsteadiness in my legs. And I went to the emergency room that night and I said, hey, I just feel like something's way off. They did an x-ray of my lumbar because that's where I was having that sort of that dull. When I said a dull ache, it's sort of like it was like a dull gripping ache. Like it wants you to kind of, there's something off there, but it was never sharp. So I did that. The next day they gave me some prednisone, like a taper for that. That seemed to help the lower back a little bit. But I went to an orthopedic the next day, back physician, and he said, well, it's probably a herniated disc that can cause weakness in both legs without sciatica. And I thought that was kind of weird because I usually thought that would be in one leg. But he said, come back in 8 weeks and let me know what's going on. And I didn't like that response. So I went to another doctor and another VCU Health. You probably know VCU, it's a university here, but um, he said, let's just do a full scale MRI. And this was on May 18th. And so they did an MRI, cervical, thoracic, lumbar, got the results back and said, everything looks pretty good. I don't think it's your back. And I said, okay. So I had an EMG done just to rule out anything like neuromuscular. All that came back good. Peripheral artery, that came back good. Anything you can imagine, I was doing. Now I slowly got better. I would say through June, but this last month of July, I felt like that heaviness start to come back, and this time I felt more tingling and a little bit more intermittent. I wouldn't say numbness. I would just say like loss of sensation, kind of hopping around both legs, and also some cramping in my calves. And when that started to go up my leg on the MRI that you have is from August 1st, I knew an ER doctor and I went in. It's a small local hospital. I said, hey, this is kind of creeping up toward my lower back, my buttocks. Not what I've had before. Could I get in and see you? She said, yeah, let's do an MRI to make sure you don't have anything like a cauda equina thing going on here. And that MRI came back and they said, we don't see anything wrong. But to be frank with you, I feel like I've got some form of stenosis because it's mostly when I'm walking is when I feel this issue. And I don't have a problem so much standing for a while because I have a standing desk. but it's when I start to get a little bit active, my legs feel like they want to just lock up, and I kept trying to trace it to a nerve root. Maybe there's a nerve root compressed. Where does this one go? And it's kind of moved around a little bit. So I just thought kind of enough's enough. I want to try to get a second opinion. And so here we are.
Yeah. Well, let's take a look at your MRI real quick, because I think that'll be helpful. Well, here's the scoliosis. So this is your spine, and if we kind of go right down the middle of these two, instead of continuing down, the spine curves over here, and then as we get to the bottom, it curves back. So this is your right hip and your left hip and your sacroiliac. So that should be straight up and down, and that's the extent of the scoliosis, and it's not terrible. A lot of people have, just this little bit of scoliotic curve. You can see it best, I think, right there. But that really does not explain, especially with the absence of back pain, the symptoms that you're having. You definitely don't have stenosis, narrowing. This is your spinal canal here. And as we go up, we see this one little disc here, but it's not much. And really, it looks quite good all the way up. I'm just looking at your cauda equina. Everything looks fine. And so really not an explanation there. But you definitely have symptoms of what is called claudication, which is weakness with walking. And there's generally two forms of claudication. There's claudication that comes from nerve problems, which, as far as we can tell, you do not have. The other kind of claudication comes from blood flow. And you mentioned that you had a arterial study. Did you have an ultrasound? Tell me about that. What'd they do?
Yeah, so a couple things. There was an ultrasound for blood clots, I think, done. And then there was peripheral artery disease. I think they took blood pressure at the both legs and both arms, and did an evaluation there.
So they took your blood pressure in your arms and your legs, and that's called ankle brachial index, and that was the same on both sides, which would indicate that everything was okay.
Yeah.
I think the problem is vascular, there's basically, it's not your spine. So it's one of two things. It's either some kind of vascular problem, which for all the world seems unlikely. You're healthy, you're athletic, you don't have any heart problems or anything like that.
No.
But we really need to rule that out anyway, because if you did have some weirdo vascular issue, that's something you want to know about and get fixed before something happens. A second possibility is that this relates to it's a metabolic issue, that you're deficient in some electrolyte, and that is the underlying, that when your body gets stressed enough that this minor electrolyte deficiency comes out, that's when you're getting it. And so if you're not already, I would recommend that you just start a daily multivitamin. It can't hurt. And I would also take an additional B vitamin supplement. The likelihood of this helping you is very low, but gosh, we're having the hottest summer ever. And that's when the problem is occurring. So it's not hard to imagine that there's some sort of a fluctuant potassium issue or other metabolic problem. Hey, I know the answer to this is going to be no, but I just want to ask on the off chance. Nobody in the family's ever had any problems with their potassium control that you're aware of, have they?
Not that I'm aware of.
You would know, because it's a significant thing. It can affect the heart. There are some familial low potassium states that can act like this, but the majority of people who get weakness and cramps with walking are dehydrated and have some sort of a low level of an electrolyte. So I would say those are the things that need to be done, some supplementation and a much more, the ankle brachial index that you had is a very fine screening test, but it's kind of based on the idea that there's a peripheral asymmetry problem, and your problem is not asymmetric, it's both sides. So if there is a vascular issue, then it is more likely in the spinal, in this blood supply to the spinal cord, which is in the thoracic spine and is not going to show up on the ABI. So I would recommend getting an ultrasound, arterial ultrasound study of the peripheral vessels, like the extreme version of that is an angiogram, which I would not recommend because there's that they have to put something in you and there's a low risk to that study, but they can do that with ultrasound to make sure there's good perfusion. So usually those are done in vascular labs, and most of the time it's a vascular surgeon. So if you Google vascular lab, and you live in Virginia?
Yes.
Yeah, you'll get, and you might, if your primary might be able to help you. Say you need a arteriogram from a vascular lab to assess your peripheral flow, and your diagnosis is vascular claudication. If that were to come back negative and it goes away with the vitamins, hallelujah. But
right.
If this continues to happen, then you actually do need an angiogram. And in particular, we would want you to see a vascular neurologist.
Okay.
And that's a doctor you're going to have to go to a tertiary medical center, like to the university or someplace like that, to get in touch with. It's not a bad idea. Often those guys are not easy to see. It's not a bad idea to start researching who that would be right now. Don't panic, but those doctors are often called stroke neurologists.
Okay.
Because that's most of what they do. But there is an outside chance that we're dealing with some sort of a vascular supply to the spinal cord issue. These things are extraordinarily rare, but they're 100% treatable. So again, it falls into that category of, if that's what's wrong, we would want to detect that. So getting connected with, who did your EMG? Was it a community neurologist?
It was VCU Health. It was to the university.
Well, I'm sure they're great.
Yeah, I mean, she seemed very thorough. She's like, I want to rule out, the big scaries, like the neuromuscular stuff. And we'd certainly do that. When they said that, I was like, oh gosh, let's get that out of the way. So I have had an MRI on my brain too. And they said there were no lesions or anything like that. So feel like I've checked
it's
a lot
not
of
a brain
boxes.
issue. It can't be your brain, because the pathways come up through the spinal cord and then they cross and then they separate. So you can't affect both legs without affecting. It has to be lower down. The abnormality, what neurologists call localization, has to be in your spinal cord or out in the muscles themselves. Can't be a nerve, can't be sciatica. You were right about that original. No, can't be that. It has to be either the spinal cord or the way the neuromuscular junction is interacting with you. You had that ruled out by what sounds like a real good neurologist. So you've had a, I'm sorry to say, a long workup already, and these things are often frustrating. But the next step would be, but thank God there's a lot of bad things that aren't happening here, right?
Yeah.
Like ALS and all those neuromuscular conditions, which would be detected by that EMG. All of that's not going on. So I know it sucked having the needles poked in you, but it was necessary.
At that point, like you get to a point where you're like, I'm fed up, so let's just do whatever, let's,
Yeah,
that was
I hear
tolerable.
you. I hear you, and on a human level, but it's still really good news that it did not I mean,
Oh yeah, for sure.
yeah.
For
All right,
sure.
so are you on any vitamins by any chance, or any supplements?
I take like a multivitamin, vitamin D, magnesium, milk thistle, things that are good for the nerves, I guess.
Oh,
But
so you're already taking a multivitamin.
yeah, so that should have I know it should have B12 in it, right? I'll take a look, but
Now you're fine. Yeah, you're fine
yeah.
on that. And you don't have B12 deficiency, or they would have known that when they did the
Yeah.
EMG workup. So yeah, I would say then don't add a multivitamin, but I would add an electrolyte. All these sports drinks.
Mm-hmm.
Yeah, I would add an electrolyte rich sports drink instead of water
Mm-hmm.
right now in the summer, just to be sure you're getting enough of the routine stuff.
Okay. Definitely.
It
Definitely.
doesn't take that much of an abnormality to trigger the symptoms sometimes. So in other words, they test your blood and everything's normal, and you're like, well, that's not it. But sometimes that is it. It's just your body runs at a different gear.
Yeah, and it's weird too, because when this initially came on in May, and then when I got to like middle of June, after I sort of got the all clear on some of the big tests, I was like, well, I'm just going to try to get back to normal. I'm not one to chase a diagnosis, I'm just not going to do that.
Yeah.
And so I'm like, I'm gonna get back to normal, and things were I kind of seem to be improving. And then, middle late July, it's just like popped up again a couple of weeks ago. So the fact that I've got some numbness, I'll say numbness, it's like loss of sensation. I wouldn't say like I can still feel, but
yeah.
It's just bizarre. Any chance, and I know you mentioned the thoracic, any chance this is cervical or thoracic? I have had the full spine MRI as of May 18th, and they said they didn't see anything, but
it is cervical or thoracic. Whatever's wrong,
oh,
that's
okay.
where, yeah, whatever's
Okay.
wrong, that's almost certainly where it is. It's not lumbar, but it has to be above your L1 because that's where the cord is. To affect both legs and everything the way it is, has to be in the cord. So it is. And the fact that you had those MRIs, and I haven't seen them, but they were normal, that means that, and we would be looking for something really big. That would mean that it's not that's okay. That just means it's not a giant herniated disc or you're not stenotic there. So as long as those things are okay, you're okay.
I think if I remember correctly, I think there were a couple of minimal herniations in my thoracic that I can kind of feel those a little
Yeah.
bit, but
Yeah.
I feel like I've had those for a little while, and that's not really that big
It's
a
your
deal.
scoliosis is gonna have felt like that. That's from that, and that's a red herring. That's just
Yeah.
true unrelated kind of deal.
So in terms of revisiting cervical or thoracic MRIs, am I past that now, or?
Yeah, I don't think that as long as those MRIs were done at a good place and they were accepted by your doctors, it's very unlikely that repeating the MRI is going to show it. If you think about it, whatever's happening is episodic, meaning
Mhm.
it's got a beginning, a middle, and an end. Nothing that shows up on an MRI is like that. MRI
Mhm.
shows structural issues that are going to be, it would be going from bad to worse. So
Mhm.
this is an episodic problem, and in the nervous system, episodic problems are either vascular or electrical. There really aren't any electrical conditions that would not have been ruled out by the EMG. So you're
Mhm.
left with vascular, and or it's a kind of a weird variant of a neuromuscular junction issue that's subclinical. So they didn't detect it because maybe your potassium was normal, but maybe it's not normal for you. And
Hmm.
so that's where the sports drinks might be able to keep you on the right level.
Okay.
I've seen a couple cases like yours over the years, not many, but a
Mhm.
handful. And one turned out to be a spinal cord AVM. It's a very rare condition where blood flow is filtered. The blood flow to the spinal cord got diverted from an artery to a vein because of something the person was born with. Those are
Mhm.
only diagnosable by by invasive studies, arteriography of the spinal cord, which itself risks spinal cord stroke, and we're not going to risk a catastrophic complication for something that is so rare and so unknown. So we got to get there step by step, and your next step, I think, is those other things.
Okay. Well, I want to make sure I wrote these down right. You said an arteriogram, is that right?
Yeah, an arterial blood flow study of some kind. You can do this these days, depending on the vascular lab. They can do it with ultrasound. Others would actually do it with CT. So it just
Mhm.
depends, and I would trust whatever that lab, however they like to assess it, is the right way to go.
Okay. Can do. Um, is there anything else you'd be doing if you were me? Just those things?
Those are the things, but I would
So
definitely do
leave
them.
the
And
orthopedic back doctors alone at this point.
yeah, they got nothing. They're not going to
We've
help you.
checked that box. I got you.
Yeah, you check that box exactly.
Gotcha. All right. Well, I think the only other question I had, and I want to be respectful of your time. Let me just make sure. I think I had one other question that maybe wasn't spine related, maybe more of a general question. I noticed on that, well, I think it is spine related, but it's more of a curiosity thing. On the little bulging disc that you pointed out there, and at least on the MRI, from what I could tell on the sagittal, where you can see the up and down. it looked like there was maybe some, oh, thank you. Yeah, that one. Is it herniated forward, like on the other side of the spine? Or is that, you know what I'm talking about?
Yeah, this is actually going toward your belly. So this one is in the front of the spine. This is herniated in the back. And herniations in the front happen all the time, but they don't matter.
Okay.
And
I
this
saw
is
that
the
and I was like,
apex
that's
of,
like
yeah,
weird.
this is where your spine is mostly curved. So that's
Okay.
why this level, which normally is that one of the healthiest ones, these two have, been bearing the weight of a crooked fence post for a long time. So
Okay.
that's why they're like that. And it's not causing these symptoms.
Would your advice for a long-term strategy is to keep core strength as good as possible for that?
100% core
Yeah.
strength, some form of traction, the inversion tables, or something that can stretch you out. Chiropractic is routine maintenance chiropractic around your sport is very helpful. Sometimes our sports actually over time get us into accentuating the deformity. And, the professional athletes now travel with teams of chiropractors
Yeah, yeah.
for good reason. And so that kind of maintenance stuff, I think you're on the right path.
How these two vascular tests, or it sounds like there's maybe two. Um, I mean, should I be doing this promptly? Is there anything I should be, you know, going 100 miles? I mean, should I be doing this with urgency or?
I would do it with persistence.
Okay.
It needs to be done, but it's the likelihood of finding anything is low. So I don't think it's going to matter whether you do it this week or next month, but it needs to be done.
Okay.
And so
Gotcha. If those come back, we've checked that box and we're doing the electrolytes. Anything else out there
that's
that's
stroke neurologist.
stroke neurologist? Okay.
Yeah. Stroke neurologist time. There's something going on in the vascular supply to the cord, and they would be the ones to help you figure it out.
Got it. Okay. Thank you so much. That's
Yeah,
helpful.
you're welcome. Sorry you're
I'm
going through this, and I'm sorry we can't get to it today, but you know what? You never want to be in medicine as an interesting patient, and sorry, that's what you are.
Yeah, that's okay. Thank you for your time. Oh, and I wanted to tell you, I think I saw from one of your videos that you're a recent grandfather, so I wanted to tell you
Yeah,
congratulations.
thank you so much. I appreciate that. Yeah,
Enjoy it.
best job ever.
You got it, man. Have a good one. I appreciate your time.
You too.
Thank you.